So, welcome. Welcome to today's 1 hour webinar on the new 2021 one session opioid and InShape, which is alcohol and drug prevention plus wellness programs. Most of our programs have been updated here at Prevention Plus Wellness, located in beautiful St. Augustine, Florida. While it's cool today, I'm seeing that the sun is shining, so I hope it's nice where you're at and that you're safe and healthy and doing well. Thanks for joining us. We have a filled session, although I think unlike Tuesday, where we had some people have a problem log in because we were so overfilled, I think today will not be a problem. But do make sure if you know somebody who wants to get in on this session, have them get over and log in as soon as possible, just in case, because we do have more people registered that then can actually join this session. So we've got 1 hour today. I'm recording this session as I usually do, and I'll be sending everyone who's registered a link. So if you can't view it, if you've, what happens is life happens and you can't, attend these training sessions like you'd like, no problems. I'll send everybody a link and you'll be able to view it at your leisure from the comfort of your office, home, wherever you like. So we've got 1 hour together, and please today feel free to participate as much as possible. And so to start out with, let's do this. Well, let me just hold off. Let me just introduce what we're doing today. So again, my name is Dr. Chudley Wirch, and I'm president and founder at Prevention Plus Wellness, located in St. Augustine, Florida. As I said, today's session, as you could see, is on the opioid and the InShape PPW programs. The 4 objectives before us are, I'm going to walk you through and let you explore the contents in the new manuals. As I said, we've updated most of our prevention program manuals that come with a physical, hard copy manual, as well as a link to the digital downloads of all the reproducible materials. So it ends up being very cost effective for those prevention and health specialists across the country and world that are using our programs. So I'm going to be showing you these programs for adolescents and young adults. By the way, the InShape Prevention Plus Wellness program, which is for young adults, focuses on alcohol, tobacco, and other drugs. Obviously, the opioid PPW program focuses on opioid use prevention. That's for adolescents. So that's the difference. You've got the opioid program for adolescents, although we do have a version of the opioid PPW program also for high-risk young men and another for high-risk young women. Keep that in mind. We got 3 versions of the opioid PPW program, and the InShape program is for young adults. InShape, by the way, is being implemented in college campuses, communities, U.S. military, other places where there's young adults. Opioid PPW programs being implemented in any setting where you find adolescents or young adults. So we'll explore the contents in these new manuals. We'll also compare the scripts for providing these programs to youth and young adults individually as in groups, as well as in groups, in person, as well as online. And we'll take a look at the PowerPoint slides for the programs. And I've already mentioned the digital download. So once again, you do get a digital download. You copy that to your device for safekeeping, and then you can copy any number of materials you want to provide your program to any number of youth or young adults. So it's very, very cost effective. Also, the digital download includes your PowerPoint slides for your program. Lastly, we're going to identify, well, I'll just mention along the way that we do have, starting now, that we do have some really good resources on our website, preventionpluswellness.com. Excuse me, under the heading of resources, believe it or not, yeah, just click on, go to preventionpluswellness.com, find the menu on our website on the homepage, and it'll open up and click on resources. There's a lot of resources there that are free. And of course, we do have our programs and our online training for program implementers and trainers as well for sale. So that's what we're going to cover today. And I will send everyone who's registered today a certificate for 1 hour CE for spending time with us. So no concerns, no worries. I will send this to you today. If you don't see it, if you don't get an email from me today, excuse me, please just check your spam folder or check your organization's IT, because sometimes some of these emails that come to people that have an attachment, which is the certificate, may be sent to spam or may be blocked in some way. So keep that in mind. You don't have to request the CE certificate. I'll be sending it to you. So to start out with, if you wish, why don't you find the chat space? It's under the More, M-O-R-E heading with the three, at least on mine screen, with the three horizontal dots. And then you point your cursor at that and you find chat. And if you'd like, you could introduce yourself to those who are attending today. You could introduce your name, your organization, where you're at. It's always fun to see who's calling in and who's attending our webinars because we have people from all across the country. We have people from all 50 states implementing Prevention Plus Wellness programs and abroad. So it's always a lot of fun to see where people are coming from. And as people type in their names, their organizations, their regions, their states, their countries, feel free to take a look at that and see where people are coming in from. So thank you all that have registered today. Thank you all, especially that are joining us for today's session. And you can see as you scroll down, you got people from all over the place. So feel free to type in your name, your organization, your location, so you could see we got people from Virginia and elsewhere. You can see that. So you guys are awesome. Thank you for taking, there you go, Florida. You've got Ocala, that's just down south of us here in St. Augustine. We got people from Kentucky, Mississippi, all these beautiful states, New Hampshire. That's amazing, isn't it? Fort Knox, that's crazy. So Louisiana, I'm just having fun looking at. We got Dawn from Hanley. Hi, Dawn. Hanley Foundation, south of us in Florida. We got people from the great state of New York, Rochester, Kentucky, Mississippi, great places, north, south, east. Mostly I see New York again, Buffalo, Chicago, that's where I was born, beautiful city. New Jersey, Arkansas, where we spent 6 years, in 6 years in Fayetteville, beautiful place. So anyway, I'm going to stop at this point. So you can keep registering, keep signing in if you want to, and share with each other anything you want. This is your time, this is your hour. If you have questions, anytime you have a question, just type it into the chat space. And we will get to that as soon as we can, likely toward the end of today's session. If you have a comment you want to make as a prevention specialist, you want to share something that's working for you or a problem you're having with, here's a great venue for sharing that with each other. By the way, just as an aside, we do have a Facebook group. I think it's called Substance Use Prevention Plus Wellness Providers Group, something like that. Look it up, because that's a great place for those of you that want to ask questions and learn more from individuals that are actually providing our programs throughout the country and world. So what I'm going to do is spend about a little bit of time on both programs today, InShape and Opioid, showing you the manuals and showing the slides of both, so that you get a little feel for both of these programs. So the unique thing about these programs, of course, the commonality is that they're all, both of them are single session screening brief interventions. InShape is an evidence-based program. That means it's been evaluated, found to be effective. That evidence has been published in scientific referee journal articles, and then it's been listed on a number of evidence-based registries. And then what opioid PPW program is an adaptation of InShape. So it's actually a spin-off or a modification of InShape. Both InShape and opioid PPW, all PPW programs, that's prevention plus wellness programs, use an evidence-based practices screening and brief intervention format. Okay, so let's start with InShape, and we'll get to both programs. We'll get to the manuals. We'll get to the slides as well. So no problem. We're going to take a look at all of it today. Give you a little overview of everything. So that is not, well, let's start here. Let's start with the InShape slides. I was going to try to pull up the manual, but let's look at the slides because that's what I grabbed onto first. So your PPW programs come with slides. The idea here is that as you, and let me just review for those of you that may not, that know this and may not know this, that PPW programs involve three steps: screening youth for their current health habits to increase awareness about their health behaviors. That includes substance use, alcohol, tobacco, opioids, marijuana, vaping, e-cigarettes, etc. And protective wellness behaviors, physical activity, sports, breakfast, nutrition, sleep, stress control. That's step one: screening youth and young adults for the current health habits, increase awareness about their health habits. Secondly, providing feedback on each of those behaviors using positive image communication that is designed to trigger or cue unconscious images of themselves in the future, engage in these wellness behaviors, being more fit, active, healthy, successful, very, very motivating images, and then linking how alcohol, tobacco, opioids, etc., interfere with achieving those benefits, those behaviors, and those very powerful motivating images. That's step two, feedback. Step three, goal setting, multi-behavior goal setting to address not just avoiding substance use, but also increasing protective wellness behaviors. So screening, feedback, goal setting, a three-step process. Screening and brief intervention, very brief, very powerful, single session for the most part, and integrated. So we're integrating not just the prevention of substance use, but prevention of chronic disease risks, physical inactivity or sedentary lifestyle, unhealthy nutrition, inadequate sleep, uncontrolled stress, etc. So here's the InShape PPW program. This is young adults. A three-step process. Again, there's the first step. You're going to walk your young adults. And again, this is being used on college campuses, communities, even the US Air Force is using this. And you're going to walk your young adults through a screening survey so that you can increase their awareness of their healthy habits. These are the screening survey questions for the InShape PPW program. So you can see first questions about moderate physical activity, 30 minutes, most days a week. And there's some examples of that so people know what that means. What is moderate physical activity? Slow biking, fast walking, skating, dancing, swimming. And they answer very quickly, yes or no. Second question is about vigorous physical activity or exercise. 20 minutes is a recommendation most days. These recommendations are from the Centers for Disease Control, other agencies, so that they total up to about an hour or more a day for young adults. And this kind of exercise or physical activity, that which we call vigorous as opposed to or compared to moderate, it makes you sweat and breathe hard. So basketball, soccer, running, you can see the list there, yes or no. So you're asking young adults about their moderate physical activity, their and of course 30 minutes most days, vigorous physical activity, exercise 20 minutes most days. The third question is about nutrient dense foods. So this is a term that some young people may not know about, but they're going to learn in the InShape PPW program. And that means foods such as whole grain bread. You could read the list there under number 3. These are a nutrient dense food. So that's what the focus is on. And the question is, does your everyday diet consist mostly of this? The young adults answer yes or no. And again, they're answering this to themselves on a blank sheet of, on the actual screening survey that's included with the InShape program. Or if you're providing this lesson online, they can be answering these questions on a blank sheet of paper. Question 4, do you usually get 8 or more hours of sleep? Yes or no? So you can see what we're measuring: physical activity, nutrition, sleep. Question 5 is about stress control. On most days, do you use a stress control technique or strategy, such as, and there's a relatively broad list of different kinds of things. It opens up the opportunity to teach and provide more resources that may be available in your organization or region with regard to these. And of course, also included under the heading of stress control, one of the best is regular physical activity or exercise. They answered that question 5, yes or no. And then question 6, and this is for the males: last 30 days, have you had 5 or more alcoholic drinks in one day? Yes, no, or I don't drink. And then for females, in the past 30 days, have you had 4 more alcoholic drinks in a day? Yes, no, I don't know, or I don't drink, excuse me. That's the definition of binge drinking. If you have 4 more drinks for females, 5 or more for males in one setting, that's considered binge drinking. That's why we're asking that. And then question 7, the last question: past 30 days, have you smoked 1 or more cigarettes? Yes or no? So 7 very quick questions. Answer yes or no for the most part. Very quick, takes a couple minutes to implement the screening survey and increase awareness for each participant about their, on a broad range of healthy behaviors. All right, then you launch into the feedback. This is the second stage of the PPW model. And this is, of course, we're talking about InShape, young adults. So you've got the screening survey, that was step 1. Feedback, step 2. So see that the slides are restating the initial screening survey question. So you could say, oh, you already answered this, or you could answer this again yourself. Most days a week, you engage in moderate physical activity at least 30 minutes, such as fast walking, slow biking, skating, etc. Then you're going to provide feedback. And so you got a couple of components to this feedback. Most of the feedback consists of a 2-stage messaging. The first stage, which is represented in this first slide, is you're going to provide benefits of that wellness behavior. Of course, this is moderate physical activity. What are the benefits? And especially, you're going to show any image terms. So, for example, you can see in the left-hand column, physically active young adults feel more energetic, sleep better, look and feel more fit. In the right-hand column, or right-hand blue block, you can see regular physical activity enhances mental well-being, self-esteem, confidence, eases anxiety and mild depression, reduces stress, lets you work harder and smarter. So really good, really good benefits. And some of these are image terms: energetic, fit. Those elicit that unconscious image that young people have, actually everyone has, of a desired future self. And to the extent that that is a value in their lives, then that increases their motivation for change and their willingness to set goals to achieve a better and improved self. By the way, at the same time, you're presenting this feedback. You have your manual, and it's completely scripted. So whether you're presenting this to one youth, you have a individual script, one-on-one. You have a group script for 2 or more. You can provide this script to young people in person or virtually, like we're doing today with Zoom or any other online platform. And so it's a very efficient. So you practice your script and your manual, you show your slide. It's very easy. And because it's scripted, that helps to ensure it's the same implementation, whether you provide it today or next year, whether you provide it or I provided. That increases fidelity and reliability of program implementation by having that script. And it also reduces the amount of training necessary to provide our programs. In fact, we have our online as well as on site, but our training for program implementers is just 2 hours, because the script, you can really reduce the training time. We also have a 2-hour train the trainer online. So very efficient, practical types of training, which we provide online and in person. Now, one other thing I'd like to draw your attention to, notice the pictures or the illustrations. We want participating young adults who are receiving these messages on InShape program to see images of themselves, representation. That's why we show males and females. We have different ethnicities, different positive behaviors. That's what we're trying to do with those images. So this is a two-step messaging process, as I said. This is the first step. This is the first slide, and the first imaging that you'll see highlights the benefits and positive images associated with the first target behavior, which is moderate physical activity. The next slide highlights how alcohol, tobacco, and drugs interferes. This is where we integrate and tie in how counterproductive and harmful substance use can be, whether that's opioids in the opioid PPW program or it's alcohol, tobacco, and other drugs in the InShape and Sport PPW program. So you can see using too much alcohol interferes with creating a physically active lifestyle, decreases energy, causes feelings, discomfort, fatigue, poor coordination. That's sort of really, really good content about how alcohol, drugs interferes with that moderate physical activity and generally having a physically active lifestyle. So that's the two-step messaging process. Then you're going to go on to the next screening survey question and provide feedback on that. That was this item here. Most days a week, do you engage in vigorous exercise, at least 20 minutes, etc.? So here's the benefits of vigorous exercise. You can see all the benefits: burn off excess weight, fat, control weight, athletic look, healthy heart and lungs, etc. Lots and lots of good content there. Benefits, and there's some nice positive images of some young people in a group running down the road. Then here's how too much alcohol interferes, alcohol and tobacco and other drugs, with being regularly active, participating in vigorous exercise. And so that's the process. That's the feedback. You're going to go through that all through these other behaviors: sleep, nutrition, stress control, and then you're going to get to drinking. You're going to get to alcohol use past 30 days, 5 or more, or 4 or more for females, and you're going to highlight some problems associated. First of all, you're going to define binge drinking or heavy drinking. Then you're going to talk about some of the other negative effects that are relevant to young people. Embarrassing yourself in front of friends, very, very very important to young people. Losing self-control, getting in arguments, etc. Then there's a slide on perceptions of heavy drinkers, not very positive perceptions, and that using too much alcohol interferes with important life goals, decreases energy, etc. Then feedback on tobacco, smoking, cigarette smoking, and generally you could even expand this to e-cigarettes. So you could see some of the negative effects of cigarette use, reducing stamina, making it more likely to quit exercise, sports, etc. And then a question for the participants, and it's sort of a dualist, or we're sort of forcing a dualistic thinking. Are you physically active? Or the opposite, are you sedentary? Are you athletic? Or are you inactive? So we were just asking them to think about where they fit on this actually continuum, or we're actually showing it as bipolar, to get them to really think about themselves and where would they want to be on those categories, which represent each of the target behaviors: moderate physical activity, vigorous physical activity, nutrition, sleep, stress control, alcohol use, tobacco use. Then there's recommendations for increasing wellness. Notice they include all of the behaviors that you provided, that you assessed during the screening survey and provided feedback on. Get regular moderate physical activity, get plenty of vigorous physical activity, control daily stress, eat a healthy diet, get plenty of sleep, and most important, avoid, to achieve your fitness goals, alcohol, especially heavy drinking, stop smoking cigarettes, avoid e-cigarettes and other substances there. And then complete a goal plan. This is step 3. If when you implement this face-to-face, you will hand the goal plan to your participants. If you implement this online, what you do is you show the following slides and walk them through goal setting, which they can provide on which they can complete on a blank sheet of paper. We also now in our new 2021 programs have a link to a follow-up online goal plan. You could actually use that follow-up goal plan at this point. You could have them click on the goal plan. It goes to a SurveyMonkey goal plan, and you could walk them through how to complete it online if you'd like to do that. Here's the 8th point online goal plan. If you have them complete it just right now using these slides and have them completed on a blank sheet of paper. Remember, you also have a copy of a goal plan if you present this in person, and you could just distribute your goal plan. This is the 3rd step of the intervention process: screening, feedback, goal setting. This is the action piece. The first step's screening, feedback, motivation. This is the action piece. The goal setting is action. We want them to initiate behavior change. Research shows that goal setting is very important to changing behavior. This is a unique process because unlike other goal setting, we're going to ask young adults in this case, or adolescents in the case of opioid, PPW, and our other programs, to set goals not just to avoid substance use, but also increase protective wellness behavior. So it's a multi-health behavior goal setting process. So what does it include? You want them to pledge to avoid substance use, as you do here. Then you want them to identify protective wellness behavior to start increasing or improving sleep, nutrition, breakfast, exercise, stress control. Any of those areas would work. You're going to have them and walk them through how to write a specific, measurable, attainable goal. That includes the quantity of that goal as well as the frequency of the goal, to identify who they're going to share the goal with or even have co-sign the goal. This research shows really enhances motivation for change. This is the contract part of the goal setting. Really important. You don't want to leave this out. This will, to the extent that young people share their goals with others, that will really amp up the motivation for change. Then you're going to ask them where they're going to post their goals. So you're going to do a little planning process, which is very important. They think through it. I'm going to post my goals and then get the sign it, get a cosign, and then some very important congratulation comments here. So what we've done actually in our actual hard copy of our goal plans now, as well as our online goal plan, there's also a brand new component, and that is a 7-day log. So, your participating young adults or youth are able to log from the goal setting instruction date for the next 7 days. Did they achieve a goal? Didn't they achieve a goal? Or did they not have a goal for that day? So that at the end of 7 days, they'll be able to count the number of goals achieved. That'll give them some feedback, and that will help promote next week's goal setting, support their goal setting. And the whole idea here is, to the extent that you can reinforce goal setting for them, even give them feedback, you will teach them self-regulation skills, so they learn how to shape their own health habits. This could be in the health area, of course, but in the future, they may use this skill to set goals as a business entrepreneur, as an athlete, to get a job, relationships, etc. Very, very, very important skill that what we're talking about here, goal setting. So let me pause at this point. Those were the slides for the InShape Prevention Plus Wellness program. Let me pause and see if anybody has any questions or any comments. Was anything unclear about what I talked about right here before we go on to the opioid PPW program, which, as I said earlier, is a adaptation of InShape, but addressing opioids rather than alcohol and tobacco. So if you have a question, now's the time to answer it. Just find your chat space and type it in, and I'll see if anybody has any questions. I'll just give you a moment, because sometimes it takes a little while to find that chat option under the more, under the 3 horizontal dots. and then to type in your question. If you have a question, if you have a statement, if you have anything you want to share, now is the time to do it. Just find the chat and type it in. Of course, we had people type in previously that they're from different parts of the country. I'm not sure we had anybody from different countries like we typically do. But maybe so, and I just may have missed it. We got people from, we do have, here we go. We got somebody from Seneca Nation. That is awesome. It just is always great to see people from not just throughout our country, but other countries, including today, we got people from Arkansas, California. These are some of the people I haven't, locations I haven't mentioned before: Connecticut, New Hampshire, Pittsburgh. Got a brother-in-law in Pittsburgh. Wonderful place. Okay, so I don't see any questions. Wait, let's see. Here we go. Did I miss it? Are these evidence-based programs? So, good question from Teresa. So, InShape is an evidence-based program, and as again, when we say evidence-based, because that term means different things to different people. There's no completely agreed upon definition of that. So what we mean by evidence-based is that InShape has been rigorously evaluated, control trials, outcomes have been published in scientific referee journal articles, and then InShape was listed on a number of evidence-based registries, the now defunct NREP, Blueprints for Healthy Youth Development, and a bunch of others. Now, compare that to the opioid PPW program, which is an adaptation of InShape, very similar content, model, screening, brief intervention, still behavior image conceptual model, same screening and brief intervention evidence-based practice, but opioid PPW program hasn't undergone the individual rigorous evaluation that InShape has for young adults, or our sport PPW program has been for adolescents. So that's the difference. Evidence-based practices, yes. Screening, brief intervention, all of our programs use that, all prevention plus wellness programs. But some of our programs have been individually evaluated, particularly sport for youth, InShape for young adults. Our other programs are adaptations of sport or InShape, but have not been evaluated individually. But remember, all of them use the screening and brief intervention format, which according to a whole number of organizations, CDC, NIDA, NIAAA, SAMHSA, and others, support and mention, identify, and recommend and support screening and brief intervention as an evidence-based practice. That's higher level of evidence than individual evidence-based programs. Hopefully that answered your question. So thank you for that question. That was from Teresa. Then let's see, to clarify, I'm not a member of the Seneca Nation. I just live in their traditional, okay, thank you very much for that clarification. I appreciate that. Let's see, should the individual be active as well? Youth will call you out if you are not doing it yourself. Well, yes and no, I will say to that. I'm just going to give you my opinion on this, okay? Because if that's, the problem with that is, yes, when you are providing healthy programs, you're, to a certain extent, you're a model for young people. Although the reality is young people are really looking to their peers more as models. Or but they could be influenced certainly by you. So to that extent, I agree with Raphael. Yes, it's important that you also try to be as healthy as you can. That said, if the reality is all of us can improve with regard to our healthy habits. That includes not drinking too much, not using tobacco substances, at least not in front of your youth, trying to get regular physical activity, eating well. All those things are important. In fact, when you implement PPW programs, we've seen this, a lot of instructors end up setting their own goals, improving